This is a great question. So what to expect in terms of recovery after fat grafting to your breast. So all of my liposuction patients, even if it's just a harvest fat for fat transfer, will go into a compression garment for 2 weeks. That helps squish out any of the extra tumescent or numbing fluid from the liposuction, and it also helps keep your swelling at bay, which I think decreases pain overall. And then in terms of your breasts, I'll put you into a supportive post-surgical bra. What that does is help take the weight off of your breasts. They can feel kind of heavy after we fat graft them, so it's very supportive in terms of thicker straps and a thicker band, but not too compressive because these are very delicate fat cells, and we want them to not be overly compressed. And so for the same reason, I don't let patients sleep chest down. They have to sleep on their back for the first 6 weeks. It's similar to a BBL. You can't sit on your butt for 6 weeks. All patients are allowed to shower the day after the procedure. I want them to shower by day 3. It helps keep wounds clean and decreases infection. In terms of activity, patients should be up and walking for the first 2 weeks so they don't get a blood clot in their legs. I do tell patients they can't do any vigorous exercise or vigorous activity for the first 2 weeks. That includes anything that raises your heart rate or blood pressure above normal. So totally fine to walk around the neighborhood, but don't go walk up a mountain or hike up a mountain or something like that. And then in terms of, when you can resume your normal activities and exercise, you can do that after 2 weeks with the caveat that you can't do any really vigorous bouncing movements. So this is really for all the runners and joggers out there. That can really put a lot of pressure on the fat cells that are very delicate while they heal in. So if you're a runner or a jogger, you really should lay off of that activity for 6 weeks, and then you can resume that with a really supportive bra. In terms of diet, I have all of my patients try to take in as much protein as they can for the first 6 weeks. That just helps heal all of the liposuction wounds and helps the fat graft take better. So those are just some kind of general guidelines to expect after fat grafting to the breast.